ORS is the single medical discovery of 20th century that has the potential to save so many lives at such a little cost over such a short period of time. Friends, in this ORS week, let us express our gratitude to three great Indian doctors who pioneered the work in ORS. It was Dr. Hemendranath Chatterjee from Kolkata, who first orally rehydrated his patients of cholera without using IV fluids. Dr. Dilip Mahalanobis, again from West Bengal, who used it in 1971 in a refugee camp. And finally, Dr. Dhiman Barua, who used it a year before in African continent. So if ORS is so useful, and if we are convinced about it, then 100% of our prescriptions for acute watery diarrhea should have it. But the NFHS 5 data, though the final pan-India data is not yet out, talking about Maharashtra says 40% of us do not use ORS and 63% of us do not even write zinc. Another study published from Eastern India says 89% of prescriptions were not talking about hydration status of patients. Almost all were silent, talking about SAM status before giving IV fluids. 80% of us used antibiotics and about 37% also used prebiotic, probiotic or antispasmodic drugs. So why is it so important to talk about SAM status before giving IV fluids? Because it is a reductive adaptive status in SAM which results in high intracellular sodium and low potassium. So overzealous management of shock and dehydration with IV fluids can result in fluid overload and sodium retention. Talking about antibiotics, we know there are only 5 indications of antibiotics. A child with cholera, gross blood in stools, a child with severe malnutrition, immunodeficient child, or the child with associated systemic infection. But a child with acute watery diarrhea following a viral infection is much more common rather than all these indications. So why do we write antibiotics? So friends, in this ORS week, let us all pledge to write a prescription of ORS and zinc in every patient of acute watery diarrhea and not to write an antibiotic. Following these 2 simple steps, along with a word about nutrition, will go a long way in faster and complete recovery of our patients. Thank you.